How to use SARS-CoV-2 antigen self-test, saliva lowly. Component of the test kit, SARS-CoV-2 antigen test midstream. Saliva collection cup, biohazard waste bag, user manual and quick reference guide. Check the expiry date on the foil pouch. Do not use the test if the expiry date has passed. Specimen collection. First, wash and dry hands before performing specimen collection. Do not eat, drink, smoke, or chew gum at least 30 minutes before taking the test. Open the aluminum foil pouch of the midstream. Make sure the midstream is intact. Perform the test right after opening the sealed pouch of the midstream. Split into the saliva collection cup. Collect saliva by dipping the absorbent tip in the saliva collection cup. When sampling, let saliva naturally absorb on the absorbent tip. When the midstream soaked with saliva, you will see the purple color moves across window in the center part of midstream. Wait 10 minutes before reading the test result. Wash your hands with soap or cleansing gel after finished. Interpret the test result. Positive result. SARS-CoV-2 antigen is detected. 2 lines appear at both C and T lines, no matter how faint the color is. A positive result indicates that you are likely to have COVID-19. Please contact your health services and comply to the isolation procedure. You may be required to confirm the test result using RT-PCR method. Negative result. SARS-CoV-2 antigen is not detected. 1 colored line appears at C. No line appears at T. A negative result indicates that SARS-CoV-2 antigen does not present in the specimen. You are unlikely to have COVID-19. Even though your test result is negative, you should follow social distancing and preventive health measures. In case you have symptoms or suspected COVID-19 infection, you may test again after 1 to 2 days because the SARS-CoV-2 antigen may not reach detectable level at all stages. Invalid result. In case there is no C line, the test result is invalid. You may perform the test incorrectly. Please repeat the test with a new test kit. Disposal. Pour the washing detergent into the midstream. The tested midstream is collected into the biohazard waste bag and disposed according to the local regulations. With regards from Health Impact.